Alzheimer's disease. Alzheimer's disease insidiously strips away memory and cognitive functions, leaving individuals unable to recognize loved ones or carry out simple tasks. It involves the buildup of amyloid plaques and tau tangles in the brain, which disrupt communication between neurons and ultimately lead to neuronal death. Over time, this progression results in severe memory loss, confusion, mood swings, language breakdown, and long-term memory erosion, fundamentally altering a person's personality and ability to function independently. Parkinson's disease. Parkinson's disease is marked by the degeneration of neurons in an area of the brain that controls movement, leading to the hallmark symptoms of tremors, rigid muscles, and slowed movement. The loss of these nerve cells reduces dopamine, a key neurotransmitter that communicates movement signals in the brain, causing progressive difficulty with walking, balance, and coordination. Symptoms grow worse over time, affecting speech, swallowing, and facial expressions, and often are accompanied by non-motor symptoms, including depression and anxiety. Multiple sclerosis, MS. Multiple sclerosis is a disease where the body's immune system attacks the protective sheath, myelin, that covers nerve fibers, causing communication problems between the brain and the rest of the body. This can lead to permanent damage or deterioration of the nerves. Symptoms vary widely, but may include numbness, impairment of speech and of muscular coordination, blurred vision, and severe fatigue. The disease can be unpredictable, with some experiencing mild symptoms and others becoming severely disabled over time. Epilepsy. Epilepsy encompasses a spectrum of brain disorders characterized by recurrent and unprovoked seizures, which are sudden surges of electrical activity in the brain. It can manifest through a range of symptoms, from staring spells and involuntary movements to loss of consciousness and severe convulsions. The causes of epilepsy can be diverse, including genetic predispositions, brain trauma, and infections, and managing life with epilepsy often involves a combination of medication, lifestyle adjustments, and sometimes surgery. Stroke. A stroke occurs when the blood supply to a part of the brain is suddenly interrupted, ischemic stroke, or when a blood vessel in the brain bursts, hemorrhagic stroke. This can lead to brain cells being deprived of oxygen and nutrients, which causes them to die. The brain functions controlled by the affected area, such as speech, movement, and memory, can be lost or impaired. The severity of a stroke can vary greatly depending on the location and extent of brain damage. Immediate medical intervention can often minimize long-term effects and improve recovery chances. Migraine. Migraines are intense and debilitating headaches, often accompanied by nausea, vomiting, and extreme sensitivity to light and sound. These headaches often involve a throbbing pain on one side of the head and can last for hours or even days. Migraines can be triggered by various factors, including stress, certain foods, hormonal changes, or environmental changes. Chronic sufferers may experience frequent attacks that significantly impact their quality of life, requiring a combination of preventive strategies and acute treatment. Amyotrophic lateral sclerosis, ALS. Amyotrophic lateral sclerosis is a fatal neurodegenerative disease that primarily attacks cells in the brain and spinal cord responsible for controlling voluntary muscle movement. ALS leads to progressive weakness and atrophy of muscles, gradually taking away the ability to move, speak, eat, and breathe, while cognitive functions generally remain intact. There is currently no cure, and the rapid progression of ALS can lead to death within a few years of diagnosis. Huntington's disease. Huntington's disease is a genetic disorder that causes the progressive breakdown of nerve cells in the brain. It affects movement, cognitive abilities, and psychiatric conditions. Symptoms include uncontrolled movements, clumsiness and balance issues, as well as changes in personality, mood swings, and impaired judgment. As the disease progresses, cognitive abilities generally decline into dementia. Each child of a parent with Huntington's has a 50% chance of inheriting the faulty gene that leads to the disease. Traumatic brain injury, TBI. Traumatic brain injury results from a blow or jolt to the head that disrupts normal brain function. TBIs can range from mild, brief changes in mental status, to severe, prolonged periods of unconsciousness or amnesia after the injury. Symptoms can include headaches, confusion, blurred vision, behavior changes, and cognitive impairments. Long-term effects can vary widely, from complete recovery to permanent disability.
Bell's palsy. Bell's palsy causes temporary weakness or paralysis of the facial muscles, typically on one side, leading to a droop in the face, difficulty smiling, and closing the eye on the affected side. The exact cause is unknown, though it's believed to be linked to viral infections. Most people recover fully with time, but treatments can help speed recovery and reduce the chance of long-term effects. Neuropathy. Neuropathy, or peripheral neuropathy, involves damage to the peripheral nerves and can cause pain, weakness, and numbness, typically in the hands and feet. It can result from traumatic injuries, infections, metabolic problems, inherited causes, and exposure to toxins. Symptoms can impair daily activities and range in severity from mild inconvenience to debilitating conditions, depending on the type of nerves affected. Dementia. Dementia is an umbrella term used to describe various symptoms of cognitive decline, such as forgetfulness, communication difficulties, and impaired reasoning. It is more common in the elderly, with Alzheimer's being the most prevalent cause. Dementia profoundly affects a person's daily functioning and independence, requiring comprehensive care and significant adjustments to living arrangements. Guillain-Barré syndrome. Guillain-Barré syndrome is an autoimmune disorder where the body's immune system attacks the peripheral nerves, leading to rapid muscle weakness and possible paralysis. The exact cause of the syndrome is unknown, but it is often preceded by an infectious illness. Treatment involves interventions like plasmapheresis and high-dose immunoglobulins, which can help reduce the severity and duration of symptoms. Cerebral palsy. Cerebral palsy is a group of disorders that affect movement, muscle tone, and posture, caused by damage to the developing brain, either before, during, or shortly after birth. Symptoms vary widely, but can include exaggerated reflexes, floppy or rigid limbs, and involuntary motions.